Welcome back. Wednesday's hearing on eliminating the religious exemption for vaccinations is expected to be packed. The details of the bill recently released. It would bar parents from using religion as a reason for not getting their kids vaccinated, and that would mean those kids wouldn't be allowed to enroll in public school. There was a debate among lawmakers on whether to grandfather in unvaccinated students who are already enrolled in schools. So where does that stand at this point? We want to bring in State Senator Saud Anwar. He is Senate Vice Chair of the Public Health Committee, and he's a medical physician. Thanks for being here today.
Thank you so much for having me, Jen.
All right, so where did this discussion stand on grandfathering in students who aren't vaccinated but are already in schools?
Well, as of right now, there's no such plan within the bill that I have seen. And I just want to say that actually the vaccines are the victims of their success.
Explain that to me.
What it means is that in the last two generations, in the United States, we have not seen the ugly face of the infections that actually can happen and what we are preventing. And as a result of which, the people have not seen what these infections can do. And then people in the underdeveloped world or the developing world see those infections, and they are asking for vaccinations. They're asking for more resources for vaccination. And we thankfully have had good vaccination system. One of the most successful public health program is vaccination. And then because we have not seen those infection, people actually are now even having this conversation. It would be a surprise for people in other parts that we are having conversations like this right now.
How important do you think, as a medical doctor, is it for people and kids to be vaccinated?
Well, I can tell you what would be the outcome if we did not have vaccination. According to 11-year-old data, it's going to be much different even right now. There are 40,000 children who would die just from one cohort if there was no vaccination. So when people are saying that they are hesitant about children and fetal tissue, which is a very respectful thing for me as well, but 40,000 lives of children are also as important for me as well. And so I think that's one piece, and then 20 million infections would be at risk for just one cohort in the United States, and $70 billion would be the loss of healthcare system or the use of healthcare system. We don't have the healthcare capacity to have a society without vaccination any longer.
There was a lot of controversy with the release of the data, the school data that showed the numbers of unvaccinated kids now in schools. I think it was for 2017, 2018, and the beginning of this school year. Did you feel like it was the right decision to release those and have a look?
I supported it as long as the individual parents were not identified. I think the parents' privacy is very important. We needed to protect that. But more importantly, from a public health point of view, we wanted to see the trajectory. And the trajectory is very concerning because we are seeing the number of unvaccinated children increasing across the board in various segments. And we have to make sure this trajectory does not continue, because that is going to be dangerous for a lot of community members, children, and some of the most vulnerable children.
There is the medical exemption, which is still on the books right now, and I mean, as is the religious exemption, but that is not part of the bill of repealing the religious exemption. So if you and your doctor have a conversation and you both decide that it's the right move to not be vaccinated for something, that stands, correct?
Absolutely, but actually I think it's even enhanced further. And the way I look at the bill, and then I've made sure that that's in part of that conversation that's important. While we have reasons why medically people should not get vaccine, the children should not get vaccines, which are well documented, recognized, the next part is that even if somebody does not fall into that category, they have the capacity to have a conversation with their physician, the pediatrician, to be able to make this decision based on medical grounds. So this is medical-only exemptions with potential for individuals who have real concerns that they can talk to their doctors.
So the doctor would have the final word, according to this bill, from what you're looking at it. Any other sections of this bill that you think are going to come up and be an issue, or is it pretty straightforward?
Well, no, I think there are not necessarily an issue, but a good thing is that there is a group which is well-representative group that is going to continue to oversee this process. We are not closing any doors over here. We are actually looking at a way that a group would be able to watch the numbers, look at the patterns, and then see, because if something new shows up, we will have an opportunity to tighten this, improve this, and make sure it's well-representative.
You heard Brian say that not everyone in his group is completely against vaccinations. They might not want to do the HPV vaccine or, one of the other vaccines. Tell me what's in this bill. Which specific immunizations are in here?
Sure. Actually, before I even answer that, I just want to share my perspective. And have said this publicly in many public hearings as well, is that I have deep respect for my community members, people in the state of Connecticut who have concerns about vaccines and true concerns that they have for the safety of their children. So, and when people are arguing, I say, please understand that everybody's coming from a place of love for their children, so we have to respect that. And we may disagree on the numbers, we may disagree on the studies, and that is fair, but respect and mutual collaboration and understanding is very important.
Hopefully, again, that dialogue on Wednesday can remain healthy.
Yes,
hopefully.
yes, and then that's our strength as our society, and we need to make sure we adhere to that. One of the things about your question was the HPV and flu is not a part of this. So I heard the HPV is not a part of this bill, and neither is the flu vaccine, and I think that should give some comfort to at least the two vaccines that Brian had brought up that were main concerns to people.
So this is just the immunizations that the CDC recommends? Does the CDC recommend the HPV vaccine?
No, CDC does not. It's not a part of the children's vaccine at this time, mandated vaccines. This is actually part of the American Association of Pediatrics, CDC, and American Association of Family Practice, American Association of OBGYN. All of them have made these recommendations based on very significant number of studies, not only in the United States, but far beyond.
People say that the science behind vaccines is weak on the other side. Do you feel like that's totally false?
Well, I can tell you that the studies that have been done, they have looked at it in a large number. So the size of the samples have been very large, which increases the value of the results. And it's not just one study, it's study after study after study on various aspects. I mean, people have concerns about various studies. You can actually look at in depth of the studies within the United States, within Europe, Sweden, Denmark, United Kingdom. All of these studies have shown very strong results of preventing infections and some of these very significant diseases which cause not only illnesses but death in children.
What are you expecting on Wednesday?
I'm expecting emotional conversation, a lot of people coming in and speaking, and it's their right to speak. It is our responsibility to listen to their concerns. But also it is important to make sure that we make the decisions based on sound data.
Are you looking at other states who have started doing this? I mean, I know you and I had spoken before, and you had mentioned California. New Jersey tried to bring this up, but they weren't able to get it through.
So I can tell you in California, again, this caused a lot of emotions in California as well when this conversation was happening. What we also saw was that when the law was passed, the number of people in the families who were getting their children vaccinated improved significantly. So that was there, but many of the people were unhappy and they started to have homeschooling. So there is a real concern that many families have. They will make difficult choices at that time. Look, the public health policies are, I can tell you, people say I have a right to do whatever they would want. So in the same way, these conversations we were having when seatbelts came into, and people said I have a right not to wear a seatbelt. And so now we have seatbelts, now we have helmets, we have all of these responsibilities that we have from a public health point of view in the larger good of the community. Vaccines have been one of the most effective public health tool to truly increase the lifespan of America and the world, and then prevent illnesses which would actually not only cause death, severe illnesses, and impact entire families. Look at the coronavirus. If this was spreading in China right now, and then we had a vaccine, everybody would be in line in that country and beyond to get a vaccine to protect themselves, because these are deadly diseases.
Well, this bill supported by Governor Lamont. It's a Democratic bill in the House. It does have a lot of support, and so we'll see what happens to it after the public hearing. Yeah. But it certainly has a good chance of getting through this session. And
I think, I would like to believe, and I know with my conversation with some of my colleagues on the Republican side, from a public health point of view, there are a lot of Republicans who would support this as well, because they are also seeing their collective responsibility. Saving children's life is not a political issue.
All right. Dr. Saud Anwar, also a state senator, we really appreciate you coming in and talking with us about this issue.
Thank you for having me.
All right, up next, after a quick break, Plans for a massive wind farm off the Connecticut coast, driving plans to rebuild New London State Pier. Governor Lamont unveiling a final agreement last week. We're going to show it to you. Stay with us.